This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Welcome to a solo episode of the Impact Healthcare podcast. My name is Lester Morales. I am your host, and occasionally I get something stuck in my head that makes me want to record these solo episodes. I always thought when I was starting this podcast that I would use it to educate only. I would have people on that are doing the things. We would talk about the strategies. We would talk about case studies. It would be used as a platform for the movement, right? Through education, people are allowed to understand what's possible. Occasionally, I will get some inspiration in regards to a solo episode, and I'm going to record this episode in two spots, two parts. One is going to be geared for employers, and the other is going to be geared for advisors. And the theme of this solo episode that I'm going to try to keep under 10, 15 minutes is change. It's, no secret. Nobody likes change, right? The reality of it is there's very few people in this world who love to get out of their comfort zone, who love change, who love ambiguity, who love the unknown, who love, change. And I've been on the phone a lot lately and in presentations and hearing, and again, I'm going to stick to employers who, one, state that their number one asset is their employees, and that outside of salaries, health benefits is their top expense. So it is a top expense. They spend so much time on it. And let's go with some, roundabout stats. I didn't pull things. I literally just thought about this and I hit record. Number one, your benefits that you offer to your employees is one of the top reasons they either come and stay working for you. Your health benefits is one of the ways you show your employees that you care about them and really correspond and correlate to, are they really one of your biggest assets? And I know that there are a significant amount of other organizational goals and things are tugging on each other. But recruitment, retention, talent is at the top of the list of every survey and every magazine that you see, that is on the top of every CEO, CFO, HR person. Talent, keeping it, getting it, engagement with that talent, especially in the work from home, the hybrid workforce, the new age of workforce. And so we're sitting in meetings. People are unhappy with how their benefits are performing today. It's very costly. It's confusing. People don't understand it. And most employers kind of feel that they're in this rat race, right? They're in this, opaque, not understanding. I get the same thing. Thank you, sir. May I have another every single year? And so in this theme of change, 100% of what we do, but there are hundreds, if not thousands of advisors and service providers that are trying to change the status quo, that are trying to bring new things out to the marketplace. And I get such a sense from 8 out of 10 groups that we talk to that ugh, the change is hard. And I want to go through some of the, I'm going to call them excuses. They're reality, but I'm going to call them excuses that we get. Number one, my employees love insert carrier here, Blue Cross, United, Cigna, Aetna, Humana, whatever it might be. News flash. The insurance industry, the health insurance industry has a mid-teens Net Promoter Score, NPS score. This is the score that a lot of times you'll get asked to have an interview or a survey question after dealing with the service provider. And the question will be, how likely would you be to recommend this to a colleague? That is a version of how they calculate Net Promoter Scores. And with a mid-teens, the only industries that are lower than the health insurance industry are cable and internet providers. So what does this mean in real life? It means that your employees, that you may or may not think that they love their carrier so much, that the reality of it is the only group of people that they would rather talk less to is their cable and internet provider. But yet employers seem to think that this is a number one reason why change and getting out and breaking with the status quo is impossible, or it's a hurdle. Two is employees don't understand healthcare. So a lot of the model that we have a conversation with is helping members become better healthcare consumers. Like if we understand that the quality and the cost of healthcare changes depending on where somebody goes, then people not thinking about where they go doesn't allow you to take advantage of the fact that the cost and the quality is different, whether they go there or they go there. So if we know that, then we have to change the mentality from a sick care, hey, I just go react, to a proactive model. I need to go get an MRI. Where should I go? Is the notion of what we're trying to get people to think about, which is, by the way, the same consumer behavior that they've had in every other aspect of their life. You buy as a consumer of healthcare. You buy as a consumer of cars, clothes, TVs, houses, mortgages, everything different than you did 5, 10, 15 years ago. With the advancements of technology and transparency and cost and competition and all of this, and what has all of that done? It's made you a better consumer of that thing. With better consumer behavior, the price point goes down and the satisfaction level goes up. You know what you were shopping for. So when I hear this, that my employees are not healthcare experts, I need to take a step back and first of all and say, they're not an expert in what they're doing today. So you already know this, but when presented with a new idea, the first roadblock you say is, well, my employees, they're not going to understand this. They don't understand what they're doing today. They don't know what a copay is, a deductible. They hand their dental card into when they go to the doctor's office. They're so confused. But what's the answer today? There is none. Do I call my carrier to understand what the best procedure is or who the best surgeon is? I don't like talking to them. Their NPS score, I rate just slightly above internet and cable providers. I don't want to walk into HR because maybe I don't feel comfortable talking to them, or if an HR professional is listening, you don't want every employee coming to ask you a question. So in the models that allow advocacy, an advocate, a concierge of sort to be offered and presented to employees, and the first rebuttal is, my employees aren't going to understand this. They don't understand what they're doing today. You know what they do understand, however, is how to be thrifty. People know how to be thrifty. You have today employees that are sitting on the floor on Sundays, cutting out 39-cent coupons for lima beans, but you think that with an opportunity to save $5,000 on a deductible, that your employees aren't going to change their consumer behaviors, that they wouldn't pick up the phone and call an advocate and go get their MRI down the street to save $100, $200, $500, $5,000. You don't think that knowing that Dr. Jones has a 92 quality score, but I was going to Dr. Smith and he has a 26, you don't think that they would change their mind? I need you to check yourself, because the people that are probably hearing my voice right now are in the corner office, or at least they have an office. And when you think about it, I want to draw a correlation, and I did some math here. If your deductible today is $5,000, I just want to play with that. Your deductible is $5,000. And I know that I have had clients say to me, let's just increase some cost a little bit more. I don't have time for this change. We don't have time for this change. My employees don't understand this. They'd rather pay a little more with Blue Cross. Let's just go with $5,000. Well, first of all, the average person doesn't have $400 in the bank. A majority of the people that are in debt from healthcare are in debt from values that are less than $1,000. And when you pair that with 60 to 65% of people who file personal bankruptcies are because of medical expenses, and most of those people have health insurance, the reality of continuing to do the same thing just doesn't make sense. Add on top of that people don't understand what they're doing right now. The NPS scores are super low. We spend more than any other major developed country in the world, but we don't live longer. The model isn't broken. The model's completely designed wrong. It's screwed. And it's going to take you to drive change in order to make this happen. So let's go back to this decision making. Your renewal comes out. Your advisor shops it to the same 3, 4, 5 carriers, none of which you actually have a vested interest to save you money, because what you call premium, they call revenue, and nobody wakes up in the morning wanting to lower their revenues. And the conversation, because I've had it out of my mouth in the early parts of my career, and I say, hey, I did a claim stratification. I looked, there's only 6 people that would have been impacted if we take your deductible from $4,000 to $5,000. Everybody sits back and says, I could save 6% on my renewal, and not save. I'm buying a crappier plan for more money. Let's go ahead and call a spade in this conversation. We talk about the word save in our business, but the reality of it is it's not saving anything. You pay more each year for a plan that is crappier than the year before. Congratulations, industry. We've done a terrible job. So now we've taken that deductible to $5,000, and everybody that is in the room making that decision thinks $1,000. Not that big of a deal. You might even think $5,000. At least I am okay. But I want to draw the correlation, and let's just pretend that you are an HR professional and you make $85,000 a year, and your average person makes $55,000 a year. Okay, 85 versus 50. A $5,000 deductible to somebody making $55,000 feels like if you were to have a $15,000 deductible. Now let me ask you a question, Mr. or Mrs. HR. How does that feel? Now, you're in the corner office. You're a C-suite. You're making $250,000 a year. You're making $250,000 a year. So to you, you hate healthcare. You've also fallen for healthcare's biggest lie, which says and has you thinking you can't do anything to change the cost of healthcare, which is absolute garbage. And if you've not listened to other episodes, we continuously prove this wrong day in and day out, because the quality and the cost of healthcare changes depending on where somebody goes. You can pay using different means of payment, And if you lower the out-of-pocket for a member, that lowers the deductible, that lowers the accounts receivable for a hospital or facility, which they like, which they're in turn willing to give you a better deal. But if you're not hearing these, if you're not exploring this, if you're not managing your supply chain, Mr., Mrs., CEO, CFO, COO, like you do everything else in your business, you're missing out on a huge opportunity to maximize your second largest expense. Can you imagine how many more sales on a net sales standpoint you need in order to cut that much of expense that goes down to the bottom line? Increased margin, EBITDA, can be achieved by paying more attention to what you typically go. Now let's go back to this story, $250,000. That would feel like you, Mr. CFO, Mr. Mrs. CEO, had a $23,000 deductible. Now, keeping up with the Joneses, $250,000 a year, a lot of money a year, but when you're sending your kids to the nicest private schools, you live in the nice houses, you're members of the country club, at the end of the day, $23,000 extra on top of books, tuitions, vacations, plaid skirts for private schools, all of those things. That's a tough pill to swallow. So I need the word empathy to come into the conversation around change. And that next time you are presented with an opportunity to think a little bit differently, that you stop and think about that word change. How many times in the last 10 years have you had to strip away benefits? Have you had to increase what's coming out of somebody's paycheck? Have you had to increase deductibles and out of pockets? For some of you, every year. Maybe COVID gave you a little bit of a break in that, but the reality of it is healthcare cost has increased since 1960 every single year. And the major insurance companies, most of which are publicly traded companies, do not view you as their end clients. They have a fiduciary responsibility to Wall Street, to their shareholders. And how do they make money? By charging you more money. So this episode is all about the word change. And I want you to think about this conversation as you're going into 70% of employers renew their benefits on January 1st. So we're getting into and ramping up for busy season. I want you to take this into consideration. When you get your renewal, don't allow the same old crap to occur. Demand more. Demand to see things that are outside of what you've seen before. If you're not getting it from your advisor, go get it from someone else. Go check out our podcast. See the guests that are on our podcast. Give us a call. Give them a call. I don't care who you call, but not doing anything is making a decision. Doing nothing is change, because the reality of it is people can't afford healthcare today, let alone if you continuously keep kicking the can down the road and doing nothing. Change is good when the outcome of the change can impact lives. And what I am telling you, and the last thing I want you to hear my voice, is that with the right strategies, with the right headspace, you as an organization can make the single biggest impact to your employees and to your organization, because saving 15, 20, 25% compounded every year for the next several years will have more of a financial impact on you and your employees than any other thing that you can do. You need to start looking at your health benefits like the other professional services and things you spend your time on. If you don't think of your advisor, your broker, like you think of your accountant or your attorney, get a new one that you think that way, or demand them to step up their game and make you think of them that way, because they can impact way more dollars than any other one of your advisors. Your P&C advisor, workers' comp is a drop in the bucket versus healthcare. Your consultants in other areas, your second largest P&L expense item is benefits. Go check. And here's the cherry and the sprinkles on top. You can impact your employee and their families' lives. You can give them better benefits. You could take away cost. You could give them an advocate that helps them, navigate the two most confusing ecosystems there are in the world, healthcare and health insurance. And yes, they are different. But it all starts with you deciding you want to be part of the change. Speaking of, the last thing I'll leave you with, I am a producer and one of the main subject matter experts in a documentary. It's the first ever of its kind. It's not personal. It's healthcare. Business is the name of it. And it gathers subject matter experts from healthcare delivery folks, the people that run hospitals and surgery centers, to people who have ran the health plan for the state of New Jersey and understand what happens in politics and healthcare. Me, who I've been a healthcare advisor for the largest institutions in the world. Other folks who are advisors or different pieces of the food chain. Somebody who is, part of the propaganda of making sure that high deductible HSA plans were popular and how it has impacted people. It is remarkable. It's one of the most proud things I've ever done in my life. I'm going to link to it here in the show notes. If you want a full copy of it, click on the link and let us know. We'll send you one. It is worth an hour and 15 minutes of your time. Again, you are the only person that can drive change. That change is good for your business. That change is good for you. That change is good for the lives of your employees and their families. I urge you, I recommend you, I double dog dare you, if that's what it's going to take for you to take change by the horns and be the leader of that change. Thanks so much for listening to this solo episode of Impact Healthcare. Thanks so much.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.